Hi, I'm Shannon. I'm one of the nurses at North Texas ID. I'm going to show you a few tips that will help during your home IV administration to make things easier. First thing I want to talk about is hand washing. Proper hand washing, you should wash your hands in warm soapy water for at least 15 seconds, which is long enough to sing happy birthday to yourself twice. Or you can use a hand sanitizer, get a good healthy amount, rub vigorously, and let it completely dry before you put on your gloves. There will be separate videos listed that teach you how to go through all the steps to do your specific antibiotic therapy. This is just a video to show you tips on some of the things that you'll need to use during those videos.
Cool.
One of the things that you'll need to know is how to evacuate the air from a syringe before you attach it. You should have gloves on during this. After you've washed your hands, I want to show you how to evacuate the air from the syringe. You'll take the cap off. You're going to hold this in your hand. Don't let the end of the cap touch the table. You're going to pull back on the syringe first to release the suction, and then you'll slowly ease up. And it's easier if you hold the syringe here instead of down at the bottom. You're going to slowly ease the syringe up until you get a droplet of water out the top, and you'll recap your syringe, and that takes the air out of the syringe. Something else that's important to know is how to effectively clean the end of your injection cap. So you'll open up an alcohol swab. You're going to completely cover the end of the cap, the injection cap. You're going to vigorously scrub for 15 seconds again, which again is long enough to sing happy birthday to yourself twice. And it's the vigorous motion and the alcohol that cleans the injection cap. Now, after you're done cleaning, if you hold this in your hand, you can attach your syringe. I'm going to show you how to do that. This is the best place to hold the injection cap here. You can use your other hand to unscrew the cap to the syringe. You can drop that. And the way that you attach them is you put the lower lock into the end of the cap and you twist clockwise. There you go. So you're gonna, when you're holding your line, you should always hold here or here, but never here. The reason is that we don't want you to accidentally disconnect your cap or your extension from your line. If you do accidentally detach these and you only get this far, you can go ahead and put that back on. If you detach it and you throw it in the trash, then we need to put a new cap on. You will receive a new cap in your kit, but you also have a clamp. You can clamp here if you have a clamp on your line. Most do not have this clamp, so you have this clamp in your kit as well. You'll clamp that, you'll hold on to it, try to prop it to where it won't touch the table, because this end right here should be sterile. You'll have a clamp in your cap in your kit. You'll detach that. This is the sterile end. You'll detach that and you'll screw that back on. If this end touches the table, you would need to clean this very well with an alcohol swab for 15 seconds, and then you can reattach your cap. Your nurse will tell you to cover your PICC line when you shower in Glad Press and Seal saran wrap. This is an example with regular saran wrap, and if that's all you have, I'll show you how to use regular saran wrap. You should take a small washcloth or gauze and cover the PICC site because it's going to stick to everything. And then you can wind up your lines in here. And then you should position the arm to where you can wrap the saran wrap around the arm twice. Obviously, I know you can't roll your arm. You'll just have a family member help you wrap it at least twice in saran wrap. The Glad Press and Seal will seal itself at the top and the bottom. If you're using regular saran wrap, you'll receive medical tape in your kit that you can cover the bottom and the top, and then you should be able to shower.